as the country grows more and more desperate for a coronavirus solution and endgame. Just moments ago, a CDC advisory panel voted 13-1 that the first doses of an authorized vaccine should be offered first to both healthcare personnel as well as residents of long-term care facilities. Joining our conversation right in the nick of time, Dr. Peter Hotez, founding dean of the National School of Tropical Medicine at Baylor College of Medicine. Dr. Hotez, can you talk about what these decisions mean? Do they have the authority to mandate this? Are these guidelines like the CDC guidelines about school? Or what they say, does that go? Does that mean that these first vaccines will largely go to the frontline healthcare workers and residents of nursing homes and long-term care facilities?
Well, Nicole, what not many people realize is that most of vaccine policy is actually set at the state level. And that's the way it's been set up. So it's the state that makes recommendations on school-age vaccines. You know, all the times I've had to go up against the anti-vaccine people, you have to do it times 50 because it's different in each state. It makes it very complicated. And this is probably along the same line. So the states, as far as I can tell, have the ultimate authority in this, so that the ACIP recommendations are just that, they're recommendations. Now, most states will likely follow those recommendations. Other states may decide that they want to tailor it specifically to certain populations, depending on the state. So, for instance, certain states that have highly vulnerable industrial workers, ranging from meatpacking plants, et cetera, may want to revise some of those guidelines. The likelihood is most will adhere to it somewhat closely. But remember, the states have been doing this now for a few months, putting together the recommendations. So it also depends on how far along they are.
How dependent are we on the manufacturing capabilities of these first companies to develop a vaccine?
Yeah, I mean, the exciting part about these vaccines is you could go very quickly from discovery into the clinic. That's the good part. The more complicated part is a brand new technology. So the scale-up manufacture is problematic, and the frozen storage is problematic, particularly the Pfizer vaccine, which requires minus 94 to 100 degrees Fahrenheit storage. The good news there is Operation Warp Speed leadership and General Gus Perna have had a lot of time to think about this. But it will slow us down somewhat, both in terms of the number of doses that we have. The hope is we'll have about 40 million doses by the end of the year, which, remember, you have to divide by 2 because there's 2 doses spaced 3 to 4 weeks apart. So if you have 40 million doses, that's 20 million individuals. And we have around 21 million healthcare workers and 3 million assisted living nursing home residents. So that pretty much takes care of the first lot. And then the hope is that we'll have additional doses in the early part of next year. And remember, we have at least 2 or 3 other vaccines coming down the pike. We have the 2 adenovirus-based vaccines from AstraZeneca Oxford. You have the J&J adenovirus vaccine. You have the Novavax particle vaccine, and maybe even our vaccine, which is now being scaled up and tested across India. So by the second quarter of next year, we'll be in a very robust program of vaccinating Americans. And then the hope is we can get to the point where we can even start looking at vaccinating most of the nation, and even possibly achieving herd immunity by later in the year if we can get the studies going in kids to start vaccinating kids. So the way to look at it is from now on, in terms of vaccines, every month is going to be better than the last month. And so we'll see this gradual evolution.
We will continue to call on you throughout this really remarkable phase with so much suffering right now, but so much hope on the horizon. Dr. Peter Hotez, thank you for spending some time with us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.